I've worked in the primary care setting for 17 years and naturally have gained a comfortable level of expertise. However, I've recently felt a certain level of dissatisfaction with my practice in that I have not seen significant improvements in the health outcomes of my patient population.
Whole health then changes the conversation from what are the problems that my patient has that's coming in today to how can we help this person coming into our clinic today to take that next step forward.
The reason I sat down to write the letter was to try to explain what it means to practice whole health. And as I was writing the letter, I realized that it had had a huge impact on the change in my practice in a very positive way.
I've been having chronic pain since the mid-'80s, and no one could figure out why. For a long time, I felt alone. I felt that no one understood what I was going through.
She was experiencing chronic pain related to fibromyalgia. With Ms. Jackson and with all of my veterans, it's important to know what their personal goals are. If somebody just told me that my heart might not function correctly later on, that might not be something that's important to me, but what might be important to me is playing with my grandkids.
My doctors, I can speak on and say that they have been an extreme help to me moving in the direction that I am right now. I can walk on my treadmill for one. I can take my dogs to the park. I can sit through a whole movie, which I couldn't do before. I can sleep. I can have a social life. And that has proven to be very important.
I think the goals that we have seen in that partnership with the veteran is really translated into both clinical outcomes as well as veteran satisfaction, so they feel part of a family, because we truly are.
At the core of what we're trying to do here is something that really is the leading edge of a trend in healthcare, and that is putting the patient at the center of everything that we do. That their health is really able to help them serve their own personal life goals. That's really a shift in direction for healthcare. It's one that VA has been leading, and it's one that we're trying to implement at the level of this healthcare system.
You can see it in their faces when they talk about whole health. There's this sort of joy in their work. I know when I'm more joyful at work, I'm gonna have more to give to the person that I'm working with. And so that's what I see as being the most amazing gift of whole health.
Those positive stories that are happening in your facility, because if you're doing whole health, you've got positive stories. There's no magic here. We aren't a one and an only, nobody else can ever create this. There's no different here than any place else in the country as far as being able to replicate this. Get that first champion to take that on, and then it spreads.
When I start talking about how these things overlap, how nutrition can impact somebody with irritable bowel syndrome, or how acupuncture can help somebody with migraines, clinical providers start to listen because, again, their toolkits have been so limited for so long that all of a sudden this idea of, oh, maybe there's other approaches that could help me with this patient, that seems to get their buy-in too. So this is that notion of whole health.
Integrative medicine looks at everything. We look at their sleep, their rest, their stress, which is huge, nutrition, communication, relationships, spirituality. If you look at the whole picture of a person, you have a much better framework to work from.
I think the whole health approach has, allowed me to recognize that certainly we're taking care of people's medical issues, but we're really taking care of the whole person. Mr. Adams has been my long-term patient, and we got him in, and there was a small spot in his stomach, which I thought was just kind of a little red area, and it turned out to be gastric cancer.
I've seen several doctors throughout my years, and I've not had one doctor, not one, that showed half the care that she has. I think is from my earliest memories that I can remember her, she was interested in what made me tick. I just think that the program, it helps you help yourself.
Finding an approach that connects with them and works uniquely with who they are as human beings is one of the most gratifying things both for the veterans and for their clinicians.
And a lot of what PACT is talking about is engaging self-management. So whole health helps that conversation forward because it helps give you tools to self-manage.
Once you really get to know your patient, you're more efficient.
I honestly do believe that if it wasn't for the VA and Dr. Elving, I would not be alive today.